Numbers that you're seeing out of our state right now concerning for you?
So I think there's a few things that we are keeping a close eye on in the state of Indiana. I'll cover that. So I have some notes. Let me start over. So there's a couple things that we're watching in the state of Indiana that we're keeping a close eye on. The first is the number of new cases. The second is hospitalizations. The third is deaths. And the fourth is just our overall census. So with that, we're seeing that Indiana is increasing. We had 1,488 positive cases today, which is our all-time high, with a 5.1% positivity rate. There were 16 new deaths, and testing has not increased in this time, but it has remained steady. We've been on an upward trend since about September 24th, last month, and we're seeing some upticks in all areas. So hospitalizations are starting to go up across the state. New cases are at an all-time high. Deaths are starting to trickle up a little bit. So these are all, I think, concerning things, but they're not shocking. The reason I say that is because we are on stage 5 reopening plan. We know we have a lot of activity around the state, and that could play a role in these, this increase in cases. So we should expect it and not be surprised.
What do you expect to see in the numbers next week, as we've been 2 weeks out from the full reopening of most of the state?
I've looked at some of the Centers for Disease Control predictions. They have some nice data now that's available on their website for all consumers to take a look at at our Indiana state rates. And the projections are looking pretty flat for deaths forecasting. And some of our internal models are looking that we may, continue to rise up. So I think that we should continue to probably expect over at least 1,000 cases, which has been our current trend.
I took a look at the dashboard for the state and the map, and it looks like the problem areas are around the Evansville area, and then there's also a surge in Henry County, whereas the rest of the state appears to be doing much better. What can you say about those two locations?
I can't speak exactly to what are some of the factors for those areas. I think that we know that some of the larger cities, areas where there are college campuses, have some of the increase in testing and higher density of population. So the northwest corner of the state has been an issue. In Marion County, that has also been an issue in the southwest corner as well. I think the state's done a great job of really dividing up the counties and creating heat maps so that those in each county can really track to see how is the COVID spread going on in that population. I think that's good for people to take a look at to see, is COVID increasing or decreasing in my community? And then they can make some decisions as to what they'll do with their activity. So.
The Chicago area, Chicago health officials are going or possibly adding Indiana to the city's emergency travel order next week. So that means Indiana residents would have to quarantine for 14 days before going to Chicago there. This is because Indiana's COVID-19 numbers are increasing. So do you think that that would be an appropriate call for the Chicago area? And is it an overreaction for that city?
That's a great question. I think each city has really good containment strategies as far as the quarantining. Quarantining is a great tool, as well as contact tracing, to control the spread of the COVID virus and to slow the pace. I think it is important for each of the states to take a look at what are the rates in the nearby states to ensure that we're keeping a close eye, and we may have to use measures like containment. Indiana may also have to do that when neighboring states are getting high as well. I think there's a lot of tools out on the web where states can do this and track and monitor trends. Indiana is increasing. We are not the only Midwestern state to increase as well. And I think, just like we said, we should have expected this, being that we're on stage 5. And I think we're going to have to be doing multiple dances where we reopen and then maybe tailor back as we cycle through COVID. Unfortunately, COVID is here to stay. We've lost our opportunity to completely diminish COVID, but what we can do right now is really control the levers as to how fast it spreads and how quickly. So,
for Chicago to take this measure or consider taking this measure, is that a negative reflection on how Indiana has handled the pandemic?
I think Indiana has done a really great job of being very data driven and really working with all entities, both private entities and public, with the government. Everyone is really partnered together to control the spread of COVID. I think they're doing an outstanding job of really monitoring their data and then using the levers that are necessary in order to control the spread. It is concerning that we have been on multiple series of weeks of increase. I think this is something that we'll have to watch to ensure the hospitals don't get overwhelmed, but that we know that the governor and the State Department of Health have been doing a really great job of tracking these numbers closely, and they'll know when the right time is to make the next step.
I know you alluded to this a couple of questions ago, but 2 weeks ago when Governor Holcomb moved us to stage 5 of the reopening plan, is that a reason that we're seeing the uptick in cases? What do you think is behind the increase that we're seeing? Is it bars and when we open bars and nightclubs that we're seeing these upticks typically?
So I think there's a few things that are causing our uptick, and I would say that we're not alone. So there are more than 25 states now that are on an increase across the country. There's only 2 states that are actually declining in COVID across the country. So we are not alone in really having issues with containing COVID. We know that there's a few different hotspots, some of the college campuses, restaurants and bars, anywhere that people are indoors, close quarters for extended periods of time are eligible to become super spreader events. So this is where COVID likes to spread. Close contact, unmasked, COVID can linger in the air for even a few hours after someone with COVID has come through the room. So the more people that you are around unmasked, the more likely that we could see these spreading events. All of this has really played a role in COVID continuing to spread as we head into the winter months. This is concerning. We would like to be on a downward slope as we head into the winter season, which is flu season. And we know that sometimes viruses can spread more in the winter because they like that dry air. Also, immune systems with the lack of vitamin D can sometimes be a little bit, suppressed. So as we head into the winter, I think we may be seeing more spread of COVID as people are going indoors more. They have less opportunity to be outside. The fresh air is good because COVID can dissipate with the fresh air, and the wind being outdoors is a great thing. So the more that we can do those outdoor activities and take advantage of the weather right now, the better.
What can Hoosiers do to mitigate the spread at this point?
I think the big thing is to remember, really from a public health perspective and from a science perspective, we see the masks as something that actually gives us more freedom to go about our daily lives and do the things we love. Yes, they aren't the cutest fashion statement, but by wearing them and building good habits around mask wearing and hand hygiene, it does allow us to go to our favorite store or to go out to a restaurant, to enjoy a meal, masking and maybe only taking it off while you eat and then putting it back on. By really kind of making this a habit, a Hoosier habit, it can go a long way to keeping COVID at bay. The masks do a few things really well. So the first is it can not only prevent COVID, but if you are exposed to someone with COVID and you're wearing the mask, what it will do is actually keep the viral load lower. So even if you're exposed with less virus, you're less likely to get more serious illness. So it can prevent the seriousness of the disease and you can build immunity that way, or you can just prevent getting COVID at all. So I know I feel pretty comfortable coming down to the hospital like I did today, wearing my mask and going on units where there's COVID patients. I feel very comfortable. I can go into that environment with my mask and then, head home. So I hope that the public can feel a good sense of confidence that by doing this, we can actually have a lot of freedom to do some of the things that we love to do just by putting the mask on and taking care of that in a season of life where we're actually living through, once in a lifetime pandemic or once in a century pandemic. These masks actually give us the ability to do more than we probably would otherwise.
How about hand washing or wiping down surfaces? That was a big thing at the beginning of this when we didn't know much about this virus. Months later, are those still big priority?
Yes, hand washing and cleaning are still a big priority. But I think the big thing to know is that COVID loves to spread it via the air. So someone coughing, someone sneezing, even someone, talking really close to you is where COVID is likely to spread. We've learned so much more about this virus than we did in the beginning. Having said that, if you are standing around someone that's sick, let's say your coworker sitting at the desk next to you has COVID and no one knows. The longer that they sit there, the virus can settle on the surfaces. And if you go up to touch their telephone or, to shake their hands, it is likely that you can acquire COVID that way. It won't live on surfaces for long, but it can live on surfaces for a certain period of time. That's why disinfecting is good. Hand hygiene is always the best thing, and we in infection prevention love clean hands because they don't spread germs, so that's always going to be our favorite tip to give you. So please continue to do that as much as you're masking. The other thing to remember is when you do to take on your mask, let's say your hands are contaminated and you're taking your mask on and off. If you touch your face with dirty hands, that can also be a source of infection. So always try to clean your hands before taking your mask on and off.
One last question for you before I let you go here. Flu season fast approaching with COVID numbers going up. Are you concerned about running out of room at local hospitals? I know you touched on that a little bit, but could that be a big concern when we mix the two?
Yes, we are definitely watching flu season, and we've learned from some other countries that have had their flu season. And what we have learned is that by masking, it can also help us reduce the flu. So reducing the flu in your community. So it is the double whammy. You put your mask on, it's going to help prevent COVID, it's going to help prevent flu. No one wants either one of those things. So I think this is a great strategy. We are watching our flu levels. We're really starting to track that, as well as other important viruses like RSV that are in circulation. There's quite a few during this winter season. So again, get your flu vaccine, when you can, wear your mask, do your hand hygiene, and that does your part in the community just to ensure that we have beds available for our patients. We in the hospital want to do everything we can to be ready to care for you in your time of need if you have to be admitted. But we want to make sure we have beds available for all of our patients that would need them. And that is an important thing as we learn to manage both COVID and flu in the winter months.
Okay, anything I'm missing?
I think the one thing we maybe want to highlight are two possible things. One is as we approach the viral season, not all fevers are going to be COVID. There will be more respiratory viruses in circulation. And so if you're concerned, if you get a fever or you're not feeling well, go ahead, you can call some of the screening tools and a doctor or a nurse will walk you through to see if it's likely to be flu or COVID. And they will refer you to one of the many testing locations that will be set up across the state. And I think the other thing is to remember that if you or your family have had COVID, there's nothing to feel bad about or shame about. This is affecting a lot of people and it can be scary, but once you recover, you can continue to go back and, into normal life. I would continue to wear a mask just because we're learning a lot about co-infection. But we do want those communities and those neighborhoods that have been affected by COVID to know that, there is nothing to fear, feel bad about, or feel shame about. This is happening to a lot of people. Even you can see people at the highest level of our government. It's affecting everyone, and we're all in it together. So, recover well, feel well, and then feel confident just getting, back into your normal life. So,
I appreciate you taking the time.
thank you so much.
Thank you.
Have a good day.
You too. Bye-bye.